Working with us in the Western Trust will provide you with a really good range of experiences, whether that's working with babies and children or working with older people. Throughout our hospitals and community services, we have a wealth of opportunity for nurses and midwives, and we would look forward to welcome you, whether to work within our community integrated teams or working within our wide range of hospital services. Our main acute centres in Derry, Londonderry, where we have the full range of acute hospital services. We have a fantastic new hospital in Omagh, which is a primary care facility including general practice services and a whole range of services for people from the beginning of life right through to the end of life. We have a fabulous environment for people who are receiving palliative care and a range of services for maternal mothers and those who are receiving allied health professional services. So all of our environments of care are really superb, and you will be assured of a wide range of experience working within the Southwest Acute Hospital in Enniskillen, which has a state-of-the-art facility throughout the environment of care for people of all ages. So I would just want to say to you that if you come and work with us, we will support you right throughout the recruitment process. We will enable you to feel that you can have a choice in where you would like to work, and we will offer rotation opportunities. We will also ensure that you have really good preceptorship, supervision and mentorship and development throughout your career. And finally, I would just say that it's a really exciting time to come and work with us in the Western Trust, because our strategic direction is developing all the time. We're really focused on being able to ensure that this is a great place to begin life, a great place to live, a great place to grow old, and the whole of this Western area is a great place to work. And if you come and work with us, we will bring you on that journey with us to create our future strategic direction and ensure that we can provide the best services for local people throughout the Western area.
The Southwest Acute Hospital has a busy rural emergency department. We see approximately 35,000 new attendances a year. We have an experienced nursing team and embrace new nurses beginning their career. We are a 24/7 Band 6 led department, and we have an emergency nurse practitioner service and a trainee advanced nurse practitioner amongst our staff. We deliver various forms of teaching, from mandatory training to trauma training to informal resuscitation training. Within the ED, we see a wide variety of patients, varying from major to minor patients to patients attending with mental health problems and patients requiring resuscitation. We are a trauma receiving unit and regularly receive trauma by NIAS transfer and occasionally by helicopter. We also regularly deliver a time-critical stroke lysis service, with our door-to-needle time being as fast as 7 minutes. Our figures for the last quarter show stroke lysis being delivered within a median time of 17 minutes, which is currently the fastest in the UK. The national average is 50 minutes. This is an example of our outstanding teamwork. We have access to 24/7 CT and lab services, and the critical care unit is just above us. We work closely with our colleagues in critical care to deliver time-critical transfers, and we also work closely with our colleagues in medical and surgical assessment unit to deal with patients coming in by GP. Our goal is to provide safe, effective, high-quality emergency care in a timely, cost-effective and sustainable manner. We aim to provide you with an excellent work-life balance in a welcoming rural community and encourage you to join us in our journey to be the best rural ED in the UK.
The Medical and Surgical Assessment Unit in the Southwest Acute Hospital is one of the few combined units in the UK which has 20 beds, a consult room and facilities for an ambulatory bay. Patients are accepted directly from the emergency department, outpatients, rapid response and the cardiac assessment unit. We are the only unit in Northern Ireland to accept direct referrals from GPs. We provide rapid assessment, early senior review and diagnosis with early access to investigations. We work in a fast-paced environment which has a high turnover of patients. We provide preceptorship to new staff, and they are given the opportunity to develop their knowledge and skills. Training and development are paramount, and we provide both in-house and certified training. We work closely with the emergency department and utilise them for opportunities for rotation and for further training. We are firm advocates of evidence-based practice, and staff are encouraged to develop new ways of working, which drives positive change for patients and staff. Our team holds a pivotal role in the patient's journey through the hospital, and in doing so we maintain good relationships with all other areas and specialties. This creates a supportive environment to work to attain organisational goals. Our combined unit houses other teams such as Hospital at Night, Opals and our own physio and OT. The facilities for an ambulatory care area, which is hoped to be developed, will provide assessment, investigations and diagnosis for patients who can be discharged that day. This will bring excellent opportunities for nurses to advance their roles and our service.
The Western Trust is a great place to work. There are a wide range of opportunities for mental health and learning disability nurses. Our services include acute inpatient care and crisis resolution home treatment teams in the community, recovery services for people with severe and enduring mental health needs, supported living for people with complex needs, and a range of specialist services including addictions, eating disorder services and adult psychological therapies in association with opportunities in primary care for mental health nursing. Come and join us.
The Rapid Response Nursing Team is a team of nurses that provide acute nursing intervention to patients in our community or in our clinical care centre when they are mobile. The main aim of our team is to promote early discharge from hospital or to prevent hospital admission in the first instance. We work very closely with consultants, GPs and specialty nurses, palliative care nurses, district nurses, haematology nurses, respiratory nurses, to name a few. Our main aim is to provide patient-centred care. The team operates from 8 a.m. until 12 midnight. Primarily, we are an infusional service offering IV antibiotics and other IV therapies, blood and blood products. After 5 p.m, we provide support to the GP out of hours, whereby they can refer any problems that district nurses or palliative care nurses would normally solve 9 to 5. We can troubleshoot and offer assistance where necessary, whereby we can provide support for the patient and their family at the end of life. Transforming community services involves partnership and passion. Here at Rapid Response, we deliver care with a capital C.
Palliative care is an holistic approach that aims to improve the quality of life for patients and their families who are facing a life-limiting condition. We try to focus on comfort for the patient and what is important for them and their loved ones at this time of their lives. This can include symptom management, and we focus on dignity, respect and choice for the patients at this time. The bulk of palliative care is delivered by the generalist multidisciplinary teams, where nurses are often the key workers, and this can be across many of the different settings, including the acute, community and private nursing home settings. So each nurse has an important and valuable role to play in delivering care to the palliative patients and the part of a larger team. In the southern sector of the Western Trust, we are fortunate to have a specialist palliative care unit where patients with complex specialist palliative care needs have their needs addressed. This can include complex symptom management, discharge planning, rehabilitation and indeed end-of-life care. However, only a small number of palliative care patients are cared for in this unit, the majority being cared for in the acute and community sectors. So therefore, as a trust, we invest in having a skilled palliative care workforce. Staff therefore in the Western Trust have career opportunities to develop their knowledge and skills in palliative care by attending CEC courses and the opportunity of becoming a palliative care link nurse in their ward or their department. The Specialist Palliative Care Team is a multi-professional team that aims to address and manage unresolved symptoms and demanding complex care needs. Specialist Palliative Care Team have had extra training and provide expert advice to support the generalist staff in providing palliative care. We aim to act as the patient's advocate and act as a resource, providing evidence-based practice. We undertake research and audit and provide education, both formal and informal. We also develop and lead on new initiatives and service developments to improve patient care. Within this, the CNS plays a key role within the team. Within the Western Trust, the palliative care approach is a very valued and important approach within all our nursing staff. Nursing staff show great compassion and great empathy towards patients and their families for those in the last year of life. Nurses often go the extra mile to make the difference, and of that we are very proud of.
I've been a nurse since 2004, so that's 14 years. I've been working at cancer services for 6 years, and it's expanding throughout those 6 years that I'm there. I'm currently a clinical nurse specialist in head and neck oncology, and fortunately here in the Western Trust we have clinical nurse specialists for each tumour site. We also have nurses who work in the chemotherapy suite and they deliver chemotherapy for cancer patients. We have outpatient nurses and we have ward level nurses who provide expert skills to patients undergoing cancer treatments and throughout. I suppose the most important thing about being a cancer nurse is the importance of following patients throughout their journey, and it is quite challenging and demanding at times, but also quite satisfying knowing that you've had an impact on somebody's life. The most rewarding part of working in cancer services is meeting brave and inspirational patients every day.